Nasogastric tube feeding and instructions. If the care receiver can no longer get enough food or take medicine through the mouth, the nasogastric tube can set up a feeding pipe by which the care receiver can take in enough food. The adequate nutrition will rely on your careful and patient delivery. Preparations: 1 tube feeding product, 1 cup of warm water, 1 feeding syringe, 1 towel, appropriate amount of tissues. Steps of feeding: help the care receiver to be in a semi-Fowler's position or Fowler's position. Wash your hands. Organize the tools and utensils and create a cozy environment. Place the towel under the cheeks to keep the care receiver or bedsheet tidy and clean. Before feeding, use the syringe to withdraw and make sure the gastrostomy tube is still in the stomach. Check the amount of gastric remnant. Connect the syringe to the end of the gastrostomy tube and slowly inject liquid food into it. Draw the food or medicine with the syringe and have the syringe positioned at about 45 to 60 centimeters above the abdomen. Feed the food at an appropriate speed. After feeding, rinse the tube with 30 to 50 cc of warm boiled water to avoid gastrostomy tube obstruction or remnant food fermentation in the tube. Seal the tube. Record the formula and feeding amount. After feeding, continue to take semi-Fowler's position or Fowler's position for 30 to 60 minutes, and then lie the care receiver down so as to prevent aspiration pneumonia or choking. During the process, the care receiver should be careful not to let air mix into the tube and must cease feeding once abnormal conditions, such as coughing, vomiting, purple face, etc., are observed. In this case, the care receiver should be kept under close observation. Instructions: the temperature in the stomach is 37.5 to 38 degrees Celsius. In order to avoid irritating the stomach wall, the ideal temperature of the liquid food should be close to it, about 37 degrees Celsius. If the tube has left its original position, please seek assistance from the professional. When removing the syringe from the tube, be careful to not let air flow into it before properly folding the end of the tube over.